All right, we are live. Another week, and as this pandemic evolves, we're going to continue to bring more guests and try to get different types of guests and get answers for everybody. If you do have a question, remember, if you're watching on the webinar on Zoom, you can put them in the Q&A area. Otherwise, if you're watching this on Facebook Live, put it in the comments and we'll try to get to as many questions as possible. Tonight, we are joined by two doctors, so very honored. And so I personally like to leave the introductions up to the people themselves. So you can describe, Dr. Daniel, do you want to go first?
Yeah, sure. My name's Dan Diekema. I'm an infectious diseases specialist. I also specialize in infection prevention and epidemiology, and then I have training in clinical microbiology, so the diagnosis of infections as well.
Wonderful.
I'm Mike Edmond. I'm also an infectious disease doctor and hospital epidemiologist.
Sorry, I saw the dog and I got distracted.
Yeah, no.
We're big fans of Zoom dogs on our staff. We tend to bring them to our campaign meetings. So I apologize.
That's all right.
For interrupting. But the reason we all got connected is both of you combined to write something in the Des Moines Register. And do you guys want to talk about that and what came about and how it came about and everything?
Sure. So, the standard way that we've been able to do infection prevention, particularly in the hospital setting with regards to diseases like COVID, involve the use of medical grade face masks. But one of the problems that we have with this particular outbreak is that the face masks are in very short supply. And that's primarily because the supply chain for these masks is deeply rooted in China. So these masks are made there. And when the outbreak affected China, the factory shut down. And so a lot of the personal protective equipment that we use on a daily basis in the hospital has become short. So as we looked at that, we started to think about other ways that we would be able to protect our healthcare workers if we didn't have face masks. And so one of the things that we thought about was to use face shields, which are clear plastic. They have in some ways a different function, but in some ways they can serve some of the same purposes. And we quickly found out that anything that was labeled as a medical face shield was also in short supply and very difficult to get. But then we realized that these products are used across many different industries, non-medical industries, like the construction trades, for example. And so they were still available and we were able to purchase them for our healthcare workers. And as we started to get all of our healthcare workers into face shields on a daily basis, we began to think about whether this might be a solution for everybody. People in the community is to have face masks available to them. And so that's how we started to think about this.
Yeah. And one of the things I think is on everybody's mind is what happens after, like how we get out of this. And when I read your article, to me, it seemed like, oh, this is a way where, I mean, obviously we still got to keep our social distancing and do different things, but this is a way for us to have a just a little bit more protection for us to do, kind of go back to where we were a couple months ago, but still have additional protection. And is that right? Or
So yeah, I think that if we had everybody in a face shield, we believe that the transmission of this infection would be greatly reduced. And we would be able to and we've talked a lot about bending the curve, we would bend the curve faster. And I think we could all return to normal life more quickly if we could get this adapted for everyone.
Yeah. One of the things that I read recently was in Iowa, healthcare workers make up 20% of the people who are confirmed to have coronavirus. would this be better than what we have now for a lot of these situations, or are a lot of people just doing the mask, or where are we short supply and where do we have enough? I guess that's one of the things that a lot of people are asking me, and
Sure.
I don't know.
Well, one of the great things about the face shields is that other companies are starting to make them, companies that don't typically make them. So for example, Apple has started to produce them, Nike is producing them, and John Deere is now producing them. So, and there are other smaller companies that are sort of retrofitting their production lines to enter this space. And so the materials are easily available and cheap. And so the ability to produce them in the United States, I think, is much greater than to produce medical grade face masks.
And are they producing for healthcare workers and frontline workers? Or I assume they're doing it for that first before we can do it for the general public?
I think it depends on the company, but a lot of companies are selling to the public. And I can show you, for example, this is one right here.
Yeah.
It's a very simple face shield. This is made by a company in Illinois that normally works for the theater production industry. And because it's essentially shut down, they decided they would start making face shields. And so they're producing about 1,000 a day in their factory.
Wow, well, that's great. And approximately how much would that cost?
This one here costs $15.
Oh, that's reasonable. And then the N95 masks that everyone talks about, how much are those? Those aren't for public. Those are for our frontline workers. How much are those typically?
So typically they would sell for 50 cents. But a lot of companies now are selling them for, prices like $8.
Oh, wow.
Yeah, there's an awful lot of price gouging that's going on right now. And those N95s are really now we have shortages of all of our personal protective equipment, but the N95 masks that we use for certain medical procedures that generate aerosols are really in critically short supply. And so it's really a opportune time for bad actors to we've had several scenarios where we think, we might have access to N95s, and then it turns out to, just to be fraudulent or an exorbitantly priced product or never shipped, things like that. So the N95 masks are really difficult to come by. And I think one of the advantages we found for the face shields in healthcare is that if we had been using face masks, medical grade face masks, during the entire time leading up to now, we would have no face masks left. So among the advantages of the face shields in healthcare is that they provide that barrier to droplets. They prevent you from touching your mouth, your face, your nose, which a lot of people do when they have a face mask. They're constantly adjusting it, and that increases the risk of transmission. And they can be reused, so you can clean them after use and disinfect them, and really use them until they break. And so it was really the advantages of the face mask in the healthcare environment that made us start thinking about wider use in the community as well.
Yeah. Oh, that's great. And then you were talking about with N95 before we got on, you had to shave.
Yeah, I think there's another form of protection that is called a purified air-powered respirator, or PAPR, or CAPR, as they're referred to in healthcare, that can be used to protect against airborne pathogens. But those have disposables with them, and those are also unavailable now. So healthcare workers who used to use those forms of protection because they couldn't be fitted to an N95 if they had a beard, for example, they've all had to do their best to try to get fitted to an N95. And for many of us, including myself, a month ago I had a beard, not any longer.
Well, it looks good. It looks good.
So I think one of the common themes that you're hearing is that almost everything that we need to care for these patients is in short supply. And that includes the testing materials to run the test. It includes things like disinfectant wipes. Everything is in short supply. And it's that we spend a lot of our time at the hospital trying to figure out novel ways to get the things that we need, or creative solutions of finding other replacement products for the things that we would typically just not even think about on a daily basis using.
So I would assume typically you would go through some sort of distributor or something like that. Are they just so overwhelmed right now, or like are disinfectant wipes, are they made over in China as well, or is it just everyone bought them right away?
So it turns out that the disinfectant wipes are made in New York City, and those factories have been impacted by the outbreak as well.
Yeah. We're talking about the ventilators. One thing that we talk about a lot is antitrust, and what we saw was the plan with ventilators. It seemed like the company that was supposed to do a lot of these for America ended up being bought off, and then obviously a lot of it got shipped overseas as well. And so I'm very interested, post all of this, what the adjustments we make in some of the supply chain stuff. I see a lot of it in agriculture, but I'm interested in other areas as well.
So this isn't the first time this has happened. When Puerto Rico had their hurricane, which is now a year or so ago, it turns out that a lot of, for example, IV fluids are made there, and a lot of medications are made there. And a lot of the products that we use in medicine, particularly medications, are single sourced. And so if that factory goes down that makes that one product, the whole supply chain falls apart.
Yeah. And what we're seeing in the pork industry right now, in the cattle industry, with what happened in Columbus Junction and in Sioux Falls, adjustments to supply. Do you guys want to talk a little bit about what you've seen and heard from those, and just kind of people working together, and just like, what would you I guess I don't know what the proper question here other than is, what do you recommend people who have to work right now, some of the things they need to bring to the table when they go into work?
So one of the points I want to make, first of all, is that you hear a lot about how healthcare workers are heroes, and they absolutely are. They're on the front lines. They're essential. Law enforcement, all these groups that are considered essential. But add to that all the what are called critical infrastructure workers, those people who provide for food and transportation, and those folks in some cases are, I think in many cases, are even more vulnerable because they are continuing to work. And in some cases, if they're working in work environments where they're not provided proper personal protective equipment, where they're not provided the ability to physically distance to prevent transmission. And in some cases, these workers are further disenfranchised, and to the point where they're living either below poverty line or in situations at home where they have multiple generations in a small place to live. And so in some ways, it's really quite, when you talk about, for example, physical distancing or sheltering at home, in a way, you really have to be privileged to be able to do that, because many people don't have, some people don't have homes or are in shelters or in other congregate settings, or they're living in situations where if there's 20 people in one house, it's really not possible to do that kind of physical distancing. So I think there's a lot of factors at play here that right now are contributing to the epidemic in Iowa, where we have really heartbreaking and tragic outbreaks occurring in long-term care, in meatpacking plants. And what we're seeing on the healthcare side is the result of that as patients come in to the hospital in large numbers from these areas. So I think it's a huge public health challenge, and we haven't yet, met that challenge, in my opinion.
Yeah, one thing I talk about here, I know folks in Iowa, we talk about Iowa City and Cedar Rapids and Des Moines a lot. Here in Sioux City, we have Nebraska, South Dakota, and Iowa all together, and we're the tri-state area. So our head's kind of on a swivel right now, with each state doing its own thing. And so but we got our first question here. This person has a concern when they go to the grocery store and the clerks don't have gloves or masks at the register, should they be worried?
Do you want to take that, Mike, or do you want me to take that? This is it's a very common question. I'll just give my opinion.
Yeah.
There's nothing particularly magic about gloves, particularly if someone puts on a pair of gloves and wears them for several hours. Microbes can live on gloves just as well as they can live on your hands. So the best defense really, when you do have to go out in public to get essential items like food products, et cetera, is to perform very good hand hygiene after you've been out or after you've handled the groceries and put them away. And then also to, as much as possible, avoid touching your face, and the combination of performing really good hand hygiene, distancing physically 6 feet from other people, and not touching your nose and mouth and eyes. Those three things are really good protection against COVID, because the virus really, it either has to be transmitted directly in a kind of droplet from a cough or sneeze from someone who's close to you, or it has to be transmitted somehow to a mucous membrane. And that's usually from touching a contaminated surface and then touching your face. I don't know if you have anything.
And the other thing that you could do is you could, if you go to the store, you could wear a face shield, or you could wear some covering on your face because if the other person doesn't, which is I think what your question was, you still can do some things to protect yourself.
Okay, good to know. Another question here is, how are you, it says you guys, but I think it's inferring as doctors and folks holding up. they just want to know how you guys are holding up and all the stress and everything. I'm sure this is especially infectious disease people and professionals like yourself. It's got to be weighing a lot on you.
I think Dan and I are both pretty lucky, because at least right now we're doing primarily administrative work, but from time to time we are, next week, for example, I'll be seeing patients. But some of our nurses are doing this day in and day out, and all the support people that it takes to care for a patient, and there are many of them on the front line of this every day. It does wear on you. I think all of us who are in this field, we know that this is what we signed up for, but it doesn't mean that it isn't scary. I mean, even for me, having done infectious diseases for 25 years, I still find this situation to be scary. I'm fortunate because I know how to protect myself, but it's not something that, any of us find to be, a joyful thing to put yourself in that. But the joyful part is the ability to help people. And so we just have to keep continuing to focus on that.
That's great. At what infection rate is a safe for businesses to reopen? as a question. I know there's a lot that goes into that, but
so yeah, this is the $1 million question. There's no right answer to that, but I think it's pretty clear that there's not going to be a day where suddenly it's safe for everyone to go out, for every business to open, for people to interact. And one of the reasons we wrote this editorial about face shields is that the political will and the subsequent economic consequences of continuing a kind of stay-at-home approach, over time, it's just not going to be possible to keep, this degree of physical distancing that's being done in a lot of places now. And so as we go out in public again, as the economy begins to rev up again, we are still going to need to take precautions because only a small, it seems like, a lot of people have the idea that everyone is going to be infected as this pandemic comes through Iowa, comes through the US. That's not going to be the case. It's going to end up being, in all likelihood, the minority of the population. So there's going to be a lot of people who remain susceptible to this virus, and the likelihood that there will be, even after this initial sort of surge of cases, that there will be spikes in number of cases or small clusters or epidemics that occur. The hope would be that our testing capacity will increase. We will start to practice continue to practice some of the prudent measures, the hygienic measures, the hand hygiene, the physical distancing. And what we're suggesting is, as we begin to open up, if you were to be wearing a face shield in public, we actually feel that would be more protective than a mask, for the simple reason that it does keep one's hands away from one's face, it protects the eyes, and it's a really good sort of visual reminder about physical distancing as we start to sort of open up the economy in the state.
Yeah, that's a great answer. Thank you. I know it's not an easy answer, and that's what everybody wants to know right now. And so I appreciate it. I've got a lengthy question here, but from a local pediatrician who says, what are your thoughts? And this is a good one because a lot of our area up in this neck of the woods is very rural. And so what are your thoughts on the capabilities of the emergency medical services to safely transport critically ill patients from rural areas to tertiary medical centers? If we start seeing large numbers of COVID-19 cases in rural Iowa, do our EMS crews have enough PPE to transport high patient volumes? And will the turnaround time for cleaning these vehicles impact ambulance availability? So that's a lot there, but I thank you guys.
Yeah. I think that what we would hope is that patients are going to be transported to tertiary centers before they're critically ill, we would hope. That's not always the luxury that you have. Patients show up when they show up. But the earlier that we can intervene with these patients, the better off they will be. One of the things that we're doing is, once a patient is diagnosed, if they're not sick enough to be admitted to the hospital, they receive a video visit every day from one of our internists to check on them, to make sure that on a daily basis, they're continuing to do okay. And if we start to see signs where they aren't doing okay, then we bring them into the clinic and maybe give them IV fluids, check them over a little bit more than we could via the video, because the whole goal is to keep them from needing to come into the hospital. In terms of what EMS needs, I mean, they need this pretty much the same types of things that we do. They're going to need gloves and they're going to need masks. and I would recommend face shields for them too. In terms of cleaning the ambulances, the turnaround time, the cleaning for this, the one good thing about this virus is it's not difficult to kill. Most detergents, soap and water will kill it. So it's not like there's a big special type of disinfection that's going to need to be done if they were to transport one of these patients. They would simply need to wipe down the surfaces of the ambulance.
And again, you guys highly recommend the mask, or not the mask, the face shield. But this is a question about a mask, and how often should we wash the reusable cloth masks?
Yeah, we've actually been, I was in several Zoom meetings today discussing this topic. There's a lot that we don't know about the cloth masks and the effectiveness of the mask in general to prevent droplet spread. We do know, of course, that a cloth mask will become sort of contaminated pretty quickly while you're wearing it. The point of the mask is really not to protect, these cloth masks in particular, is not really to protect you from droplets from other people. It's more to try to limit the amount of droplet transmission that comes out of your mouth and nose if you cough or sneeze or vocalize. And for that, I think you just need to launder it as frequently as it feels comfortable to you. So, I mean, if I wore a cloth mask in public, which I don't currently, I would probably wash it every day or every other day. Is probably what I would do, depending on how soiled it was at the end of the day, or how contaminated I think it got.
Do you guys feel that, or I guess this is one of my questions, and I'm trying to frame it in the right way, but where should people go, like, to find answers? Like, not everyone has access to you or things. Where should just the general public go?
I think CDC's website, it has information for both medical professionals, but it also has information for the public. And so that is a place where you can go and get good, reputable information.
Wonderful.
And then for people who are more interested in delving in further, and those who are interested in Iowa specific data, the Iowa Department of Public Health is kind of improving their website almost daily in terms of their dashboard for number of cases, where cases are located, and now you can kind of drill down and see where our cases are concentrated, and they have mostly similar information to what you would find on the CDC website. And then there are a couple of very frequently used websites by epidemiologists and others who are interested that look at modeling for each state to see, where are we compared to when we think we might peak, when we might have the most people in the hospital. One of those is from the University of Washington. I don't have the web address, right in hand,
Sorry.
but I can email it to you. And another one that's got a really nice amount of data is run out of UC San Diego, and I can also send you that web link for those who really want to drill down into the numbers.
Yeah, that'd be great. If you send it to us, we will make sure we post it and let the folks know. I got two more questions if you guys have time. The first question here is, do you recommend buying a face shield or making one?
I guess it depends on how good of a do-it-yourselfer you are. If you and you can go online and you can find all kinds of videos of people doing it. Some of them are as simple as one of these plastic page protectors and a headband, and some are much more elaborate. So most craft stores, office supply stores would have the stuff that you need to make one. If you don't want to do that, there's also places online that you can order them. So I think it just depends on, what exactly you want.
Wonderful. And last question from Sarah here. Does ironing the cloth mask kill the virus?
So it turns out this virus is very sensitive to heat. So I think if you used high heat in your iron, it would very likely kill the virus. There's some information out there, that actually looks at coronaviruses and how long you have to be at a certain temperature to kill the virus. And actually, a lot of places now are disinfecting their N95 masks just using heat. So essentially, like putting it in the oven at a certain temperature for a period of time. So I think that either method would be very likely to kill the virus. Either extreme scalding heat for a short period of time, or putting the mask, in an oven at 150 degrees or something. I don't want anyone to start a fire though, so you need to be very careful with that. So,
any final thoughts or suggestions you have for the general public?
I think that, the message continues to be stay home, particularly if you're sick. Don't go out and expose other people. Don't go to work if you're sick. If you have a job where you still need to be in your place of employment, social distancing, washing your hands, repeatedly washing your hands, and not touching your face.
And then I'll just try to end on a positive note here by saying that, as Mike alluded to, we've been doing this for a quarter century, about 25 years, and have seen a lot of epidemics and then outbreaks in hospitals and other settings. And one thing that every epidemiologist learns is that every outbreak ends, and this one will end as well. So, sometimes you really want to fast forward and get to the end of it. But through the measures that Mike talks about, perhaps eventually, hopefully sooner rather than later, we'll have a vaccine. But one way or another, we're going to put this behind us, and life is going to resume.
I think that's the perfect way to end this. So, gentlemen, I deeply appreciate your willingness to chat with us and answer questions and your time. And I know this is virtual, so you can't see it, but I'm sure people are applauding you and appreciating all your efforts. So thank you.
Thank you.
Thanks for having us.